Hi friends, I am Annie, your friendly health coach. Welcome back to my platform. Today, let us have a little conversation about miscarriage. Experiencing a miscarriage could be devastating and the road ahead could be challenging. So you will need your family, loved ones, and medical professionals and definitely your faith to get through this difficult moment. I want you to know that you are not alone. Many women have had one or more miscarriages, but now they have their success stories of healthy pregnancies, and of course, now they have their children. So have faith and know that all is well. In case you are wondering what a miscarriage is, let me give you a brief description. Miscarriage is the loss of a pregnancy before 20 weeks, often due to chromosomal problems or maternal health conditions. When someone experiences miscarriage, the most common symptoms you may have are bleeding that goes from light to heavy. You have severe cramping, abdominal pain, weakness, bad or severe back pain, sometimes fever, weight loss, white pink mucus, contractions, tissue that looks like black clots passing from your vagina, and fewer signs of pregnancy. If you have these symptoms, contact your doctor or midwife immediately. They will tell you what to do, but be prepared to go to the emergency room. There are many reasons for a miscarriage, although the cause is often not recognized, such as improper implantation of fertilized egg in your uterine lining, your age. Women who are over 35 years old, please note that being 35 years old does not mean that you have a miscarriage. Abnormalities of the uterus, your cervix begins to open too early in pregnancy, your lifestyle factors such as smoking, drinking alcohol, or using recreational drugs, disorders of the immune system like lupus, severe kidney disease, congenital heart disease, certain medicines such as the acne drug isotretinoin, poor diet or malnutrition, untreated thyroid disease, issues with hormones, infections, severe high blood pressure, food poisoning, certain medications, body trauma, exposure to harmful chemicals or radiation, excessive caffeine consumption, two or more consecutive miscarriages, you are being underweight or overweight, chronic or uncontrolled conditions like diabetes, problems with the uterus or cervix. Please note that there is no scientific evidence that physical stress, sexual activity, or prolonged use of birth control pills cause miscarriage. However, always discuss this with your doctor before any physical activity or taking medication or anything else. Most miscarriages are due to natural and unpreventable causes. However, certain risk factors can increase the rates of miscarriage, like your age. If you are older than 35, you have a higher risk of miscarriage than a younger person. Another risk factor is whether you have had miscarriages in the past. If you have already had one or more miscarriages, there is a higher risk of pregnancy loss. If you also have an ongoing medical condition such as diabetes that is not being treated properly, the risk of miscarriage is higher. Another risk factor for miscarriage is the fact that certain uterine diseases or weak cervical tissue can increase the risk of miscarriage. Another factor is the consumption of illegal drugs, smoking, too much caffeine and alcohol. People who smoke have a higher risk of miscarriage than people who do not smoke. Your weight is another factor. Being underweight or overweight is associated with a higher risk of miscarriage. So talk to your doctor if you are overweight or underweight. And the final factor is your genetics. Sometimes one of the partners is healthy but carries a genetic problem that increases the risk of miscarriage. I would like to give you a few tips on how you can prevent a miscarriage. Please note that not all miscarriages can be prevented. However, you can take steps to help you maintain a healthy pregnancy. Number one, go for regular prenatal care throughout your pregnancy. Number two, maintain a weight that is healthy for you. Don't eat for two. Number three, do not smoke, drink alcohol, or use illegal drugs. Number four, take prenatal vitamins to make sure you and your developing fetus are getting enough nutrients. Number five, exercise regularly and eat a healthy diet. Always talk to your doctor about whether it is okay to exercise. Number six, avoid infections. Wash your hands thoroughly and stay away from people who are already sick. Number seven, limit your caffeine intake. Don't take more than your doctor recommends. Number eight, eat a healthy, balanced diet with plenty of fruits and vegetables. Number 9, if you have already suffered one or more miscarriages, talk to your doctor and ask for the support you need, and in case the doctor wants you to take medication during your pregnancy, especially in the first trimester. Number 10, if you have a long-term health condition, work with your doctor to keep it under control. Number 11, talk to your doctor before taking over-the-counter medications. Number 12, avoid environmental hazards such as radiation, infectious diseases, and x-rays. And the last point is avoid contact sports or activities that have a risk of injury. It is no secret that the choices we make can have an impact on our health. So please take good care of yourself. I hope you put into practice all the tips I have given you on how to prevent miscarriage. If you have any health concerns, please consult your doctor. If you have any questions or comments, please feel free to leave them below. Thank you and hey, bye.